you can pray. Okay, so let's continue. What safety measures do you have in place to prevent injuries and ensure well-being of prayers?
Most of the times we encourage sport individuals before they engage into any sporting activities to at least do some physical exercises in order to condition the body well, so that when they go outside on the pitch or on the court, they are able, they are fit, so that they avoid injuries. But also at the same time, we encourage those engaged in sports to make sure that whenever they feel they are not good, they should go and see a doctor to make sure that the doctor do some tests to ensure that they are okay, they are fit. Because sometimes one might get injured, but the injury might not look like very serious.
It might look like it's just minor.
Yes, minor. They might continue engaging in different sporting activities, but in the long run, that injury now it grows. And now it becomes now
bigger problem,
a major injury. So we encourage athletes that every time they feel like they are feeling like they're injured, we encourage them to see a doctor, but also encourage athletes to avoid engaging in sports whenever they have fatigue or they are tired, because now that's where the concentration, they lose concentration, and they are now they expose themselves to injuries. But cases of injuries, they are triggered because some might wake up, think he's fit, he goes to the court or to the pitch, he gets injured, but all in all, it is part of sport. It doesn't mean that if you are engaged in sport, you will not get injured. No. In fact, when you are in sport, you should expect to have more injuries because you are active, you are more involved. You are into tackles, you are into challenges. So we cannot avoid injuries, but we can minimize the level of injuries.
Okay, so as sports has many benefits to a person's health being, so can you say that health is one of the things that can make a person be far away from drug and substance abuse?
It depends on the priority of an individual, because drug and substance abuse is also another challenge which affect a lot of people. But you also see that in sport, you also have people who do drugs and some substance abuse, but it's not healthy to the person who is into sport, because drugs, they do not reflect the true reality of life. They take you into a different dimension of what real life is. To a sportman, that is not encouraged. That's why you have the anti-doping agency, which makes sure that they test athletes to make sure that they are drugs free. They are drugs free in order to encourage the same level of competition. Because some drugs, they might enhance your performance. They might make you to do better than the other athletes who did not take drugs. So the anti-doping agencies, they are also helping us a lot in these areas, because what we want is fair play.
Yeah.
Everyone should be on the same ground. Yeah, someone should not be advantaged because he's using drugs.
Because there are some drugs that make people faster on the field.
Yeah. So in sport, we are always encouraging fair play, and drugs are not accepted.
A priority.
Yeah.
Okay, so can you share any successful stories of participants who have improved their health or overcome health challenges through sports?
There are a lot of success. There are a lot of them. I'll give you an example. We had a work colleague. He had stroke.
Yeah.
From nowhere, he just came. He couldn't wake up in the morning, so he had stroke. His left side was dead. He could not move his leg, not move his hand. So after going to the hospital, they told him to at least have 20 minutes just walking per day.
Walking, like some physical exercise, just
walking.
Just walking.
Yeah, 20 minutes a day.
Yeah.
After 6 months, he was able. He's fine today. He's fine, and he has not stopped. He's still doing.
So he's fine. He healed from stroke. Now he's able to do anything
because of exercises. Because some of the diseases which we people face is because we do not do exercises.
We ignore exercises.
Yeah,
which makes our body weak.
And with the food we are eating nowadays, we eat a lot of fat. So the fat,
Eat a lot of junk food.
So the diseases are. So when you go to the hospital when you are sick, one remedy which is very common nowadays, they will tell you, go and do some exercises.
Yeah.
And simple and straightforward. Yes, you might have some sicknesses. They might treat you, but at the end of the day, they will tell you, go and do some exercise, at least 30 minutes a day.
Okay.
Yeah.
So how do you collaborate with healthy care professionals or organizations to promote health?
We engage them in our activities. Recently, we had the Blantyre for 2.15 kilometers race, where we also engaged the Blantyre DHO. We also engaged Beit Cure International. We also engaged Maiwatu Hospital. All this is to make sure that we know that the healthy providers, they want people who are fit. We are into sport, they are into healthy services. So we know we cannot do those without
the healthy services.
Yeah, without the healthy. So we need them in our event to make sure that they assist us whenever we have any challenges regarding in terms of health. But we also know that whenever they are present at our activities, they are in a better position to advise our athletes on how best they can take care of themselves, because they are into health. They know the mathematics, what they do there. We are into sport. We want to encourage the athletes to make sure that their performance is good. So we always engage these healthy service providers, because we know they also have a role to play in terms of athletes development and in terms of sport development in the country.
Okay, so how to encourage healthy habits such as proper nutrition and hydration among participants in such a way like these days a lot of people have bad eating habits. They might be addicted to certain foods which might lower their sports capability. So how do you encourage healthy habits?
Most of the sportsmen and sportswomen who are very active, they have those we call the dietitian. They are able to guide them what to eat and not what to eat. As council, we are always encouraging the associations as well as the athletes to make sure that their diet should be different from ordinary people, because they are active, they are participating at the world stage, so they must make sure that their diet is good. So we are always encouraging them to engage a dietitian. A dietitian does not need money. You just engage them to say, help me, I'm preparing for this tournament. How should I be eating?
How can I eat?
What food should I consume and what food should I not? How much should I eat? When should I eat? So we are always encouraging them to engage a dietitian to make sure that they assist with their diet.
Okay, so since we are talking about sports, so when we talk about gymnastics, okay, can you explain the benefits and the disadvantages of gymnastics?
I can say it's a sport which needs one to be flexible enough, which also one needs to start training at an early stage, because gymnastics is different from other sporting codes. You cannot start gymnastics at the age of 20 or 22. It means you must start gymnastics maybe at the age of 5. If you are late, maybe at the age of 7. Yeah. So it's a different, it has a lot of benefits, healthy benefits, mental benefits. It's a career. So nowadays people are earning a lot of money because of
gymnastics.
Of gymnastics. So it has a lot of benefits to an individual, but also to a nation, because some other countries are well known because of gymnastics. If we talk about China, if we talk about Korea, they are very good at gymnastics. So the gymnastics is now putting their countries on the map. So it's not only an individual, but also as a nation, there is also a lot of benefits.
Gymnastics.
Exactly.
Okay. Since you've talked about the benefits, can you also highlight on the disadvantages? Because nowadays here in Malawi, there are a lot of people who venture into gymnastics, yet they do not know that they might have some complications due to gymnastics.
To talk about the negatives, I think it would be a challenge, because I hear as council, we're always looking sport on the positive side.
Okay, I can just highlight some of the issues or complications that come due to gymnastics. One of the issues that one might face due to gymnastics, like the negativity that comes with gymnastics, is high increase of injuries. Okay, there is a high risk of acute injuries, particularly in muscles and joints. You can notice that most of the bodybuilders or the gymnastic goers, they tend to have a lot of injuries. They might injure their hands, their legs, or yeah. So particularly in their muscles and joints. And another problem that the bodybuilders face is also chronic pains. So long-term pains and discomfort in muscle joints. They can have discomfort pains in their body due to prolonged doing of gymnastics, which causes chronic pains in their bodies. And the third negativity of gymnastics that I can't say is that gymnastics cause eating disorders, because the pressure to maintain low body weight can lead to disordered eating. Gymnastics, the bodybuilders have certain foods or certain eating habits that they have to follow in their everyday life so that they should maintain their bodies. So once they stop having that regular type of food, they tend to have some difficulties, which causes eating disorders and discomfort of the body, which is not a good thing. So these are some of the negative effects that come with gymnastics.
You cannot avoid injuries.
Yeah.
Injuries are into sport, and sport they are like brothers and sisters.
Yeah.
So it will be difficult for me to talk about the negative side of gymnastics, but what I know is there are a lot of benefits when it comes to gymnastics.
Okay.
Thanks a lot, Mr. Edgar Ntulumba, Public Relations Officer for the Malawi National Sports Council. It was a pleasure having you in my podcast, where we had the chance to discuss and teach about how health and sports are related, about the benefits of sports, about the negative effects of sports, and we also had the chance to discuss some kinds of sports that are good or that can be played or participated by people with disabilities. And you also told us that sports is for everyone and sports sees no gender, whereby we increasing the interest for the people to venture into sports and improve their healthy well-being. It was an honor being with you on my podcast in this episode of Healthy Vibes Vibe, also known as HV2. Thanks a lot.